Moving healthcare from hospitals to the community will help care for patients in an environment that they are familiar with. But in a rapidly aging Singapore, where demand for healthcare services rises and manpower supply thins, there are still care gaps that need to be filled.
So one health startup decides to use technology to help plug these gaps in home care.
Healthcare startup Jaga-Me harnesses the latest technology to extend a helping hand to caregivers at home. Using smart apps, caregivers and the elderly summon licensed nurses to their homes by tapping on the icon in the phones or tablets.
A lot of investment has been put into hospitals, nursing homes and the like. These are very important for Singapore's healthcare system, but at the same time we found that it was very difficult to bring that level of care into the person's desired place of living, which is their home. So we felt that it was our duty and opportunity to create means for patients to get this care at home and to use innovation.
The 500 licensed nurses at Jaga-Me spend between 2 and 12 hours each assignment and caring for an average of more than 2,000 patients every year. Mindful that Singapore is a fast-aging society with 1 in 4 seniors aged 65 and above by 2030, Jaga-Me is obsessively looking at equipping its nurses with hard skills to administer prescribed treatment plans and soft skills to provide comfort and assurance to patients and their families.
When we go in for those home visits, most of the clients that just freshly discharged from hospital, they lack a lot of knowledge on how to care for the patient and also the disease process. And through that, we educate the patient on the medications that patients having, the side effects, the adverse effects.
The Health Ministry has been working to integrate patient care into the community. And letting patients receive such rehabilitative care, public healthcare institutions like Singapore General and Tan Tock Seng hospitals have initiated community nursing programs. The nurses are ensconced in senior activity and family service centres, working independently and drawing on not just their nursing but also organizational and clinical decision-making skills. Both hospitals currently have about 30 community nurses each.
For the community-wise, so we work very closely with our community partners. So we collaborate care and we have discussions regularly. So from there, we actually hear feedback that the follow-up, the long-term follow-up from the community partners will actually feedback to us that the patients are coping well with the medication and they're more compliant and they feel more confident staying in the community.
And following patients from the hospitals to the community, eventually to the patient's home, must be the objective to ensure patient-centric care and a more seamless transition from hospital to community.